Hello, I'm Bruce again, and today I'd like to talk about comorbidity, which sounds like a pretty maybe horrible topic, but it's related to ADHD, and I would like to speak about it a little bit because somebody asked me a question about maybe a month ago. I was actually on a video conference with a friend in Brazil, and he's asked me if depression, we were talking about ADHD, and I don't know if he has ADHD or not. I know I do. And he asked me if depression was part of it and or went along with it. And I said I believed it was a comorbidity. I know it's a comorbidity, but I would look into it a little more. Then I decided to do this short video. Now, the source I use for much of my actual understanding about ADHD or adult ADHD, I'm trying to get this in the video here, is Russell Barkley's Taking Charge of Adult ADHD. This guy really is the top authority in the United States. And for adult ADHD, he also has a book that's about childhood ADHD called Taking Charge of ADHD. So he's been working in this field for his entire professional, adult life, as far as I know. And so he has some interesting information about comorbidity with ADHD. So the idea, co means with, a prefix means with. So comorbidity is something that's wrong along with ADHD. And according to Barkley, about 80% of people have one or more comorbidities. But the top five, okay, the numbers 1 through 5 on the hit parade chart for comorbidity with ADHD are oppositional defiant disorder, or ODD, or ODD, which Barkley says about 80% of people have when they're children, and it's less than that as adults. Then the second most common is something called conduct disorder or antisocial personality. The third is substance use disorder, then anxiety, and finally depression. And I don't know the numbers, I don't remember all of them, but I did look up the number for depression. And according to Barkley's studies, and again, he's been surveying and studying this his entire life, and adult professional life, he said about 18% of adults 27 and older who have ADHD also have some level of clinical depression. That's according to his studies. So, but I want to just talk about each of those five for just a couple minutes, and then we can stop. But I thought it may be worthwhile to take your time and to take a little bit of my time to just look into this concept of comorbidity for people who have adult ADHD. Because adult ADHD doesn't describe your entire life, or certainly not mine. And there are other things that can maybe be treated and make life better for you. So that has worked out for me, and so I would like to share it. Okay, so number one, the most common comorbidity, according to Barkley, is oppositional defiant disorder. And that's where we don't like what people are saying about us or thinking about us, because they expect things of us that we can't do. And so they think that we're somehow defiant, that we're somehow different, and we begin, in my case, I internalized that, and it made me feel bad about myself, and I would sometimes act out in socially inappropriate ways, and with the adult ADHD, or then a childhood ADHD impulsiveness, I would just say things off the wall that people, just would shock people, or maybe I thought that they were going to laugh, but really I knew they were probably going to be not feeling too great about it. And I would say things that would sort of stand out, like in opposition to expected behavior. And so, yeah, a lot of people have that. I guess most people, a lot of people with ADHD have that. Barkley says 80% when they're kids. Conduct disorder is less prevalent among children and among adults, and that's a good thing, because that's like taking oppositional defiant disorder another step and actually doing things that are breaking the law, hurting people, committing crimes, having significant serious problems, and Fortunately, that is not as common. I don't know the numbers, but that is something that's associated with ADHD. It doesn't mean that everybody has ADHD is going to do that or have that, but often people who have conduct disorders also have ADHD. Substance abuse. Well, I mean, I'll raise my hand. I mean, that's me. I'm a recovering alcoholic. It's been just a little bit more than 28 years now, and I intend to keep working at it. And it is work. I didn't start drinking alcohol until I was 19 years old, my first year in college, and immediately, I mean, I knew, even though other people there was a lot of abusive drinking in college, but I just knew it was different for me, and it was a wonderful relief from my nervousness and worrying about stuff. But I very quickly got very active, and it wasn't a good thing, and it went on for a long time. Off and on, I tried to quit many times as an adult, but finally in 1991, when I was 41 years old, or I'm sorry, 45 years old. I'm losing the math, but anyway, I know the year was 1991, and that was when I stopped drinking, and wow. It was a big thing for me, and it is something I still work on. So that was but other people have problems with alcohol, certainly, or have problems with other abuse, other substances, and it's quite common. The fourth one is anxiety, and even though I describe myself as a nervous kid, I don't believe that I suffered from anxiety as a child, and I definitely don't think I do now. That's sort of an underground or overwhelming, but always going on under the surface anxiety and fear that something's bad is going to happen. And that's not me. And I can't really describe it very well because I don't know the feeling. But I do know that it's a horrible thing, because I've talked with people who suffer from it, and it's not good to live with, and it's hard to deal with. The last of the five is depression. I have never I don't think I've ever suffered from clinical depression. There have been some times when I've been depressed about things. Often that was associated with alcohol and stuff that I had done the day before or the night before, but it never stuck. With depression, that's something that can be treated, although it's difficult to treat. It can take a while to figure out the best way, working with a physician, the best way to help it. The best medication, basically, I guess, is what often people do. That and exercise. Exercise, I guess, is supposed to be wonderful for helping with depression. But so those are the five comorbidities. In my mind, I can see some relationship between oppositional disorder and conduct disorder, a relationship between those two and ADHD, because if people are labeling you and in a way kind of rejecting you because they have expectations that you can't fulfill because of your ADHD, or that at least were very, very difficult, if possible, to fulfill, then that could maybe set up some situations where one would become very defiant and act out, and it might become a pattern that in some way was rewarding, and those things can be kind of difficult to break. But anyway, the good news in all this is, the cheery side is that for people who want help and want treatment for ADHD or any of those other situations, other conditions, help is available in many ways. And in some cases, helping one, if you have two things going on, well, helping one might help the other two, or make the chances of getting over it or dealing with it or whatever better. Make those chances higher. So I'm done. I want to just make this a very brief video talking about ADHD and comorbidity, and that's what I got. So I appreciate you hanging in while I talked about this. Thank you.